Started, and here is your question. So if you have read and understood, considering the communication skills station, can you begin?
Hello, good morning. I'm Dr. Kuldeep, one of the surgical candidate. I am working for Mr. Mann in Alexandra Hospital. I'm calling to inform you about one patient who she is a post-op day 2 of post-mastectomy, presented with the axillary clearance. May I confirm you? May I confirm whom with I'm talking to?
I'm Dr. Dafur.
Sir, I just want to inform you. Good morning, sir. I just want to inform you about one patient that is 78-year-old female who just had a mastectomy with axillary clearance 2 days back for a breast cancer, sir. Now she presented with the axillary clearance, axillary swelling, with a drain of around 90 ml fresh blood, and she also had a shortness of breath. Patient is a known case of COPD with mild left ventricular failure, and she was all right on post-op day 1. Her daughter wants to her daughter wants to take her home, which is 60 mile away. I have explained, I have tried to convince both daughter and mother, but all went in vain for last 20 minutes.
Okay, I just wanted to ask: is the patient competent and able to make her decision?
Yes, sir. The patient she is well competent and to make an informed decision, sir.
Okay. So, what do you think? Do you think she's making the decision, or she's convinced by her daughter, by the other?
Sir, I think as I have gone through the discussion with her daughter. She is a working lady. Her husband is also a working lady, and she has a difficulty to communicate between the hospital and her home. I think her daughter convinced her mother to take her discharge against advice, sir.
Okay, what do you think for the case? What do you think? What might happen for her?
Sir, as it is a post-op day 2 and there is a fresh blood in the suction drain, I am thinking of a reactionary hemorrhage, and the shortness of breath might be due to acute exaggeration of the COPD or axillary thrombosis, sir.
So, what do you do if she's still in the hospital? What do you do, or what do you think the correct way to manage this case?
Sir, I will manage the patient. I will manage the patient in form of blood investigation. I will order fresh blood count to look for the fresh HB, or there is a drop in the HB due to the reactionary hemorrhage, and for ruling out the venous thromboembolism or axillary thrombo, I will go for CT pulmonary angiography, sir, if I suspect DVT or pulmonary embolism, and I will manage the patient
Okay.
accordingly, sir.
So if she insisted to go to home, what should we will do?
Sir, I will inform the daughter as well as the patient regarding all the possible complication which may occur if, as I have explained them, it is not the best in the patient's health to discharge early. I will explain all the possible complication due to premature discharge. I will ask them to sign a legal document stating all the possible complication, and I explain them to stay in the hospital, and I will explain them all the warning signs of increasing discomfort, if there is increase in exaggeration of the shortness of breath, if there is more discharge, and if there is increase in the swelling in the axilla, sir.
Okay. If she insisted Did you remove the drain, or what do you told her about?
Sir, I will keep the drain. I will keep the drain, sir. I will not remove the drain.
Okay. Who take care for her in home?
Sir, I will inform her GP, and the GP will take care of her by home visit, sir.
So how the GP knows she's discharged?
Sir, I will write a letter to the GP and stating her current condition, sir.
Okay, thank you very much. Okay, that's all.
Sir, do
Thanks,
you
sir.
want me?
Yes.
Yes.
About the social services, like they'll be looking after.
Sir, I will be informing the social services and the nurse around that to take care of the patient if something has happened, and I will ask the patient to consult our hospital or nearby hospital if emergency arises, sir, or if there is any red flag sign is there, sir.
Okay.
And about the drain?
We told.
And I
He
will.
told me.
No. When it has to be removed, then what instruction would you give? Where would patient go to get that removed, and after how long?
If the over a period of time, if the drain output has been decreased and there is no fresh bleeding, patient can remove the drain to the nearby surgical center, and if there is a swelling, patient can report to us or nearby center.
Okay. Yes.
Shall I,
Any more?
sir? Can we discharge the patient against advice, sir?
So yes, if she's insisted, she let her to sign the paper and
Yes, sir.
discharge her.
I will get the legal document signed regarding stating all the possible complications regarding the premature discharge, as well in informing stating the red flag signs, sir. Thank you, sir.
Okay. Thank you very much.
Thank you. It went so smooth. So you still have 2 minutes left. So you covered everything in 6 minutes. If there was anything you would have missed.
Ma'am,
did you discuss about the DVT and pulmonary embolism?
Yes, ma'am.
Yes.
We discussed, ma'am.
Yes. How you check the competence of the patient?
Ma'am, I will check the competence of the patient by mini mental score, ma'am. I will ask the few questions. Who is the person standing behind me? Who is the current prime minister of the country? When will the Second World War happen?
In this one,
I
you
will
have
ask the
to
patient.
only discuss the whole matter with the patient and ask the patient to summarize it back to you, so you know that she has fully understood.
Yes, ma'am. Yes, ma'am.
And then at the end, okay, you'll just reassure and do the management, and then okay. Yeah. Still time is left. That's why I'm looking to it. If we could still discuss. So differentials were there, and here are okay. Here you've covered everything. Blood test consultant will ask you, what does the blood reports show? So you have to make sure that it was done regularly. It was done
Yes,
that
ma'am.
day.
Ma'am, I have checked in the notes also. They have mentioned that there was no fresh blood was done, and I will ask the consultant is after getting off from this call, I will get a fresh blood investigation and I will inform you accordingly, ma'am.
Yes, or you can say, okay, I'll check and I'll get back to you.
Yes, ma'am.
Yeah. All right. Good. Thank you.
Thank you, ma'am.
Thank you.
Thank you, Dr. Dafar. Thank you.
Thank you very much. Thank you very much.